How does the bladder neck affect urinary function? Have you ever wondered how the bladder neck plays a role in our everyday urinary function? The bladder neck is a crucial part of the urinary system, located at the base of the bladder where it connects to the urethra. This area is not just a simple passage. It acts as a smooth muscle sphincter that is essential for controlling urine flow and maintaining urinary continence. One of the primary functions of the bladder neck is to maintain urinary continence. When the bladder fills with urine, the bladder neck remains closed. This closure prevents any involuntary leakage, keeping the bladder outlet sealed. It works in harmony with the external urethral sphincter and the pelvic floor muscles to ensure that we can hold urine until we are ready to go. When it is time to urinate, the bladder neck relaxes and opens. This allows urine to flow from the bladder into the urethra. This relaxation is perfectly timed with the contraction of the Detrusor muscle, which is the muscular wall of the bladder. Together, they create the necessary pressure to expel urine effectively. Another important role of the bladder neck is maintaining bladder pressure. It helps keep the right pressure within the bladder during urine storage. This ensures that urine is securely held until we choose to void. It is also interesting to note that the bladder neck has anatomical and functional differences between men and women. For instance, in men, the bladder neck is closely related to the prostate gland, which can influence urinary function and the risk of certain conditions. From a bladder health perspective, the bladder neck is vital for normal urinary control. Conditions affecting the bladder neck, like bladder neck obstruction or cancer, can lead to various urinary symptoms. These may include difficulty urinating, incontinence, or urinary retention. In cases of bladder cancer, tumors near the bladder neck can impair its function, making careful evaluation and treatment essential to preserve urinary control. In summary, the bladder neck acts like a valve, controlling urine flow and maintaining continence. Its proper function is crucial for bladder health, and any dysfunction can significantly impact urinary symptoms and quality of life. Always remember, if you have concerns about your urinary health, consulting a healthcare professional is the best course of action.